I remember the day I signed the mortgage papers for a home in Brightleaf Grove. My real estate agent exuded excitement, describing the manicured lawns, the peaceful cul-de-sac where children rode their bikes, and the well-established homeowners association that kept everything running smoothly. After years of moving between cramped apartments in the city, the vision of a spacious house with a backyard and a community pool was appealing. The first time I drove through the neighborhood, I admired the consistency. Each home boasted tasteful pastel paint, precise landscaping, and a symmetrical arrangement of rosebushes or evergreens in front. All mailboxes matched white with black lettering for addresses. The roads were smooth, lined by bright leaf trees that gave the area its name. A large sign near the entrance read, "Brightleaf Grove, a place to grow together." It looked like the perfect suburban nest for me, a newly minted nurse working at the local health department. The day I moved in, while unloading boxes from the truck, a tall, impeccably dressed woman approached. Her blonde hair was fashioned in a short, layered bob. She wore a crisp pastel blouse and held a clipboard bearing the Brightleaf Grove HOA logo. Flashing a polite but thin-lipped smile, she introduced herself, Karen Whitfield, the HOA president. "Welcome to our community," Karen said, voice practiced. "I'm here to ensure you've received our bylaws and guidelines. We maintain uniformity to preserve property values and keep a pleasant environment. If you have questions, my number is in the packet." She handed me a thick binder of rules, gave me a curt nod, and moved on. It was my first encounter with Karen. Her demeanor was civil but chilly, as if scanning me for potential rule-breaking. A twinge of unease stirred in my gut. However, I chalked it up to standard HOA seriousness and refocused on settling into my new home. Little did I suspect that Karen's obsession with community standards would one day clash violently with my passion for public health, culminating in a fiasco over a life-saving vaccination clinic. I worked as a community nurse at the county's public health department. My duties included home visits, health screenings, and assisting with immunization campaigns. When a national push for updated immunizations arose, especially for under-vaccinated adults, the health department launched traveling pop-up clinics in neighborhoods. The concept, bring vaccines, like flu shots, tetanus boosters, or updated immunizations, directly to where people lived, making it convenient for busy families or seniors. One day, my supervisor, Linda, said we were seeking a new suburban location for a weekend pop-up. "You live in Brightleaf Grove, right?" she asked. "We want an HOA that might let us set up a small clinic, maybe at the community center or near the pool. Residents can walk over, get their shots, no fuss." The department had found success in other neighborhoods. Vaccination rates soared when convenience improved. Excited, I offered to coordinate. "I'll talk to the HOA board. If they approve, we can do a Saturday pop-up from 9 a.m. to 2 p.m. Maybe we'll administer flu shots, plus any recommended adult vaccines, pneumococcal for seniors, Tdap for pregnant women, etc." Linda beamed. "Perfect. Let's do it. We can bring a small team, myself, a couple of RNs, some clerical staff to handle forms. We only need a few tables, chairs, and a shady area. Or inside a community room if it's hot." I was sure the board would appreciate the convenience. In the city, such pop-ups were well received. People appreciated the chance to get immunizations close to home. The health department often waived or reduced fees for those with limited insurance. It felt like a no-brainer, easy, beneficial, bridging health services to families. However, I recalled Karen's stern manner. I decided to approach Ms. Jenkins, another board member, who was friendlier. Over coffee, Ms. Jenkins loved the idea. "We want healthy neighbors, right?" She suggested we put it on the next board meeting agenda. Karen can be picky, but I think the rest of the board will see the value. Armed with department brochures, I attended the next HOA meeting. Karen's brow furrowed as I spoke, but Ms. Jenkins and other members nodded enthusiastically. I explained how the health department sets up quickly, no cost to the HOA, minimal noise or disruption, just a pop-up canopy or two. Many residents might find it convenient for flu shots. Karen asked curt questions. "Will you store medical waste on site? Will strangers flood our community?" I reassured her waste would be handled per medical guidelines and that only residents or invited guests would come. The board voted to allow the pop-up, scheduling it for a Saturday 2 weeks away at the community green space near the clubhouse. I left triumphant, not knowing Karen's grudging acceptance masked deeper reservations. We began planning. Linda secured the vaccines, flu, tetanus, shingles, COVID boosters for those needing updates. A small staff from the health department prepped forms, pamphlets, sharps containers. Meanwhile, I posted flyers around Brightleaf Grove, announcing, Vaccine Pop-Up Clinic, Saturday 9 a.m. to 2 p.m. Free or low-cost immunizations, courtesy of the county health department. Residents seemed interested. Several asked if their parents or adult children could also come. Ms. Jenkins said sure, we could sign them in as guests. Anticipation grew, especially among older folks who found traveling to the health department burdensome. However, a few days later, subtle hints emerged that Karen wasn't fully on board. She posted a message on the HOA forum titled, Concerns about Temporary Health Station, claiming some neighbors felt uneasy about the possibility of sick individuals converging on our neighborhood. She questioned whether the pop-up might endanger community safety or cause traffic congestion. She insisted residents should get vaccines at clinics or pharmacies, not bring medical procedures into our suburban environment. I was baffled. The board had approved it. Why was Karen sowing doubt? Ms. Jenkins privately messaged me, Karen's stirring trouble. She hates the idea of outsiders driving in. She claims it's unnecessary and might tarnish the neighborhood's image if people line up for shots. Ms. Jenkins told me not to worry. The board majority stood by the plan. But Karen's negativity intensified. Another forum post claimed some homeowners fear that a vaccination site invites diseases here, like if people are actively ill while seeking vaccines. That conflated a vaccination service with a disease outbreak. Linda assured me that receiving a vaccine doesn't mean you're sick. Yet Karen's fearmongering triggered some confusion among neighbors. A few posted concerns, wait, is it safe to have the clinic here? I tried to dispel misinformation, explaining how these immunizations prevent illness rather than bring it. The tension simmered. Some folks who disliked doctor visits found the pop-up appealing. Others heeded Karen's alarmist tone. I sensed we were heading toward a showdown. Linda and I pressed on, expecting a smooth day. If Karen tried to hamper us, we believed the board's official approval and the health department's authority would prevail. Little did we suspect she'd take a drastic step to cancel the entire clinic. At last, the designated Saturday arrived. The health department team rolled in around 8 a.m., setting up 2 collapsible canopies in the community green space. We arranged folding tables for check-in, stationed coolers with temperature-regulated vaccine vials, and set out chairs for waiting. Ms. Jenkins joined us, smiling. This is so exciting. We never had a health service brought right into our neighborhood before. I felt a spark of pride. As a nurse living in Brightleaf Grove, facilitating direct public health access for neighbors felt meaningful. By 8:45, a small line formed, parents with kids needing routine boosters, seniors wanting a flu shot, or neighbors who missed their tetanus updates. Linda arrived, verifying that the refrigerators in the supply van were functioning. A quiet sense of optimism pervaded. But as 9 a.m. approached, a black SUV screeched to a stop near the curb. Out stepped Karen Whitfield, face taut with anger. She marched toward our canopies, ignoring the line of waiting residents. She confronted Linda and me, voice raised. This clinic is not happening. I'm shutting it down. Startled, Linda responded, Excuse me? The HOA board approved this weeks ago. We have the right to hold this pop-up. The health department is authorized by county law. Karen waved a stack of papers. I have a new resolution from the HOA. We are canceling the event due to health concerns and disruption of neighborhood tranquility. You must pack up and leave immediately. Residents can visit official clinics off-site. We don't want a vaccine drive, here attracting outsiders and potential disease. The bystanders gasped. Ms. Jenkins hurried over. Karen, the board did no such thing. We never voted to cancel. You can't single-handedly override a prior board decision. Karen shot her a glare, claiming she had emergency authority under some vague bylaw. She demanded we dismantle the canopies. Linda tried to reason with her, explaining how vaccination clinics do not bring in sick individuals, just normal residents seeking shots. Karen wouldn't budge, threatening to call the police on us for trespassing if we didn't comply. Chaos ensued. Some residents in line argued with Karen, calling her misguided. Others, spooked, asked if they should leave. I tried to reassure them. Tension soared. Ms. Jenkins grabbed her phone, whispering she'd call other board members to clarify. Meanwhile, Karen repeated her demands, brandishing a typed letter with the HOA letterhead, likely produced unilaterally by her. Linda refused to budge, citing official county approvals. The confrontation escalated. We worried about scaring away families who needed these vaccines. I felt both furious and helpless. This was the kind of sabotage we'd feared, but we never expected it so openly. Raising her voice, Karen insisted, "If you do not dismantle this clinic, I will call the authorities. You have no right to set up a medical facility on private HOA property without full board consent. Our membership doesn't want this here." Linda calmly showed her the original board approval letter, signed by the entire board. Karen dismissed it as outdated. She repeated her new emergency resolution, though Ms. Jenkins contested it, saying she was on the board and had never seen such a resolution. Karen threatened to fine Ms. Jenkins if she continued to defy the president's directive. Residents waiting for shots became flustered. Some left, fearing conflict. Others demanded they be allowed to receive their vaccine before leaving. Linda, concerned about a scene, decided the best approach was to avoid direct confrontation. She told me quietly, "We might have to pack up for now, but I'll call the county health department's director immediately. This is beyond an HOA's authority." The heartbreak was palpable as neighbors saw the staff beginning to pack supplies. The fear of a large scene or potential police involvement overshadowed the day. Ms. Jenkins tried to reason with Karen, but was met with rigid hostility. "I am the president, and I say no," Karen repeated. By 9:20, we had partially dismantled the canopies. A few disappointed residents asked if we'd reschedule. Linda apologized, encouraging them to visit the health department downtown or wait for further updates. My stomach churned with anger at Karen's brazen sabotage. As we loaded the vaccine coolers back into the supply van, I overheard Karen telling a group of onlookers that she saved the neighborhood from an influx of sick people. It was maddening. But Linda's plan was in motion. She stepped aside, phone in hand, calling Dr. Howard, the county health director, explaining how an HOA official forcibly shut down a sanctioned clinic. "That's outrageous," I heard Dr. Howard say over the phone. "I'll have staff down there ASAP. They can't override a public health initiative." Linda relayed that a county legal counsel might also weigh in. If Karen thought her authority superseded county health directives, she was in for a rude awakening. Within an hour, 2 county vehicles arrived. Dr. Howard, a tall, middle-aged man with a calm yet commanding presence, stepped out wearing a county health department badge. Accompanying him were 2 staff members from the legal department. They approached Linda, me, and the half-disbanded team. Dr. Howard's eyes surveyed the tense scene, the canopies partially folded, volunteers looking unsettled, neighbors milling around uncertainly. He introduced himself to Karen. "Ma'am, I'm Dr. Robert Howard, County Health Director. We've been informed you attempted to shut down our approved vaccination clinic. May I see the official HOA documentation that reversed the prior board decision?" Karen, clearly startled by the official presence, tried to maintain composure. Yes, well, I have the authority to protect the neighborhood from events that cause distress. People here do not want a pop-up medical operation. The board gave me emergency powers." She handed him the typed letter. Dr. Howard scanned it, frowning. Then he turned to Ms. Jenkins, who stood behind Karen, arms folded in frustration. Ms. Jenkins declared that the board never voted on any new resolution. Karen wrote that letter herself. "The rest of us never approved it. We stand by the original unanimous vote to allow the clinic." Dr. Howard nodded, handing the letter to the legal staff, who quietly conferred. Clearing his throat, Dr. Howard addressed Karen. The county has the legal authority to provide public health services, especially with official endorsements from local boards. The original HOA agreement stands. An HOA president alone cannot unilaterally override that. If you have concerns about health or traffic, we can discuss them, but shutting us down entirely is not permissible. We have the city's and county's permission to operate here. Karen bristled. But the residents, I have complaints about diseases, about lines of sick people. Dr. Howard calmly explained that vaccination clinics do not bring actively infectious individuals. Vaccines are preventative. People come healthy to get protected. This is not a triage site for ill patients. Your fears are unfounded. Sensing the crowd forming, Dr. Howard raised his voice so bystanders could hear. We intend to restart the pop-up clinic. If the majority of your board supports it, and it was previously approved, we will proceed under county authority. We can address any logistical concerns, but we are not leaving. At that, Karen's face reddened. She tried to argue about privacy, property values, unwanted visitors. Dr. Howard repeated that we only serve consenting neighbors, the environment is safe, and no large influx of unknown outsiders would occur. A few residents chimed in, telling Karen they wanted the clinic. Ms. Jenkins confirmed no official poll indicated otherwise. The legal staff then quietly told Karen that if she continued interfering, the county might pursue legal recourse, given she was obstructing a licensed public health service. Karen sputtered, eyes flicking around, perhaps realizing she was outmatched. The official threat of legal action was not something she could steamroll with her usual HOA tactics. She stepped aside, crossing her arms, watching sullenly as the health department team began reassembling the canopies. The tide had turned. Under Dr. Howard's leadership, the pop-up clinic was reinstated that very moment. With Karen sidelined, Ms. Jenkins and other supportive neighbors helped Linda and me set the clinic back up. We re-erected the canopies, set out tables and chairs, and reopened the vaccine coolers. Dr. Howard welcomed residents, announcing that shots were once again available. A wave of relief spread among neighbors who'd returned, hoping the fiasco was resolved. Some still had to be reassured that the clinic was safe and legitimate, given Karen's earlier fearmongering. But a surprising number lined up quickly, eager to get their immunizations before the day ended. Car seats with toddlers, grandparents with walkers, couples in their 30s, people from all demographics arrived, showing forms of ID, filling out quick health questionnaires. Linda and the other nurses administered shots swiftly, placing bandages on arms, offering aftercare instructions. The atmosphere turned festive, with Ms. Jenkins distributing pamphlets about the benefits of vaccination, handing out small water bottles. The air of tension gave way to gratitude. Some neighbors even thanked me personally for bringing the clinic here, praising the convenience. Meanwhile, Karen loitered on the sidelines, arms folded, scowl etched on her face. She seemed to wrestle with whether to continue protesting or slink away. A few brave souls confronted her, asking why she tried to sabotage a beneficial service. She snapped back with remarks about preserving the quiet environment. But as she watched lines of smiling residents receiving vaccines, praising the health department, she realized the tide of opinion was overwhelmingly against her. She retreated behind a nearby tree, observing the entire process with a smoldering glare. The pop-up ran until about 2 p.m. We administered dozens of shots, flu, tetanus boosters, and even a few shingles shots for older adults. Dr. Howard tallied the final numbers, over 60 immunizations given. Many expressed how easy it was not to schedule a separate clinic trip. Linda gave me a thumbs up, the day turning from fiasco to success. I felt a wave of triumph, seeing how Karen's meddling could not stop a genuine public health initiative backed by the county. Late in the afternoon, as we packed up, Dr. Howard approached me, praising my perseverance. You did good, standing up for the community. If Karen tries more nonsense, let us know. She can't block public health. Ms. Jenkins nodded, adding that the board planned an emergency session to address Karen's unilateral actions. The day ended on a high note, though we suspected Karen's wrath might linger. News of the pop-up fiasco spread quickly through Brightleaf Grove. Many neighbors who missed the clinic or arrived late asked what happened, learning that Karen had initially canceled it but was overridden by the county. A wave of indignation rose. People questioned how the HOA president could unilaterally override a board-approved event, especially one that provided free or low-cost health services. Ms. Jenkins told me that multiple residents emailed the board, demanding accountability for Karen's attempt to sabotage a beneficial service. Some older folks were especially upset, pointing out that easy vaccine access was crucial for them. They described how worried they were that Karen had spouted misinformation about diseased people coming into the neighborhood. The next scheduled HOA board meeting loomed. I braced for tension. Ms. Jenkins confided the board was furious with Karen for bypassing them, forging a fake emergency resolution, and calling the shots alone. She hinted some members considered a motion to strip Karen of her presidency. Typically, such motions faced an uphill climb, but Karen's overreach had rattled even her supporters. Meanwhile, Karen posted on the official HOA forum, doubling down on her arguments. She wrote a statement titled, "Protecting Our Neighborhood from Health Risks," claiming that the pop-up clinic was an unneeded intrusion and that community tranquility was compromised. She argued that public health must not overshadow the homeowner's preference for a safe environment. But comments from residents blasted her. "Vaccines keep us safe. You overstepped. We want more clinics, not fewer." The tide of sentiment was clearly turning against her. Karen's final attempt at a justification involved citing an alleged complaint about traffic congestion. Ms. Jenkins posted a photo of the day, showing just a few cars parked legally, maybe 2 or 3 extra vehicles, hardly a jam. The community recognized her traffic argument was baseless. In private, Linda assured me that if Karen kept pushing, the county might consider legal measures. She can't keep spouting nonsense about the health department. We're an official entity. She's out of her league. I felt a mixture of relief and frustration, wanting this tension resolved. The vaccination day ended in success, but the community's trust in Karen was damaged. The upcoming board meeting promised to be a powder keg. A week later, an overflow crowd packed the clubhouse. The board, consisting of Ms. Jenkins, Mr. Rayburn, Ms. Castillo, Mr. Dorsey, and Karen, arranged themselves at a table facing the audience. Tension crackled. Everyone knew the top agenda item, discussing Karen's unilateral cancellation of the vaccination clinic and the subsequent standoff with the county health department. After routine items, Ms. Jenkins introduced the topic. "We have to address the events of last Saturday's pop-up clinic. Our president, Ms. Karen Whitfield, attempted to shut down a legally approved health service. We must decide how to proceed." Karen, looking defensive, launched into a monologue about how she acted in the neighborhood's best interest, citing dozens of emails from anxious residents about potential contagion. She insisted that my emergency powers permitted me to cancel an event that threatened public welfare. She brandished a folder, claiming it held evidence of resident concerns. Ms. Jenkins challenged her, pointing out the actual board-approved motion that had allowed the clinic. Mr. Rayburn added that no official poll ever indicated significant opposition. Ms. Castillo read from an email chain where Karen alone expressed reservations. The alleged emails from anxious residents turned out to be just a handful of messages from people concerned about traffic, not an overwhelming demand to cancel. Then Dr. Howard from the county, who'd come to observe, calmly rose to speak. He reiterated that the county's presence was legitimate, referencing municipal codes that allow licensed medical professionals to hold vaccination events. He stated, Karen Whitfield's attempt to forcibly end the clinic was outside her jurisdiction. The health department overcame it by direct authority. If she tries it again, we'll consider further legal steps. The room buzzed with shock at the mention of potential legal recourse. Neighbors in attendance demanded an explanation from Karen. Some told personal stories of how they needed the clinic's convenience. Others scolded Karen for ignoring the board's collective decision. Ms. Jenkins then motioned for a formal censure of Karen's actions, pointing out she had lied about an emergency resolution that never existed. Mr. Dorsey seconded it. The board voted 4-1, with Karen being the lone dissenter, to censure her. Applause broke out. Ms. Jenkins also suggested they hold a membership vote on removing her from the presidency altogether. Karen flared with indignation, but the wave of disapproval was overwhelming. Even some who once admired her strictness now realized she'd gone too far. The meeting ended with a swirl of angry murmurs and a victory for the vaccination project. Karen slunk away, face tight with anger, refusing to address reporters from a local news channel that had shown up. The fiasco had gone public, painting her as the official who tried to block free vaccines. As local media caught wind, a short news segment titled, "HOA President Attempts to Cancel Neighborhood Vaccine Clinic," aired on a regional channel. They interviewed Dr. Howard, who politely explained that confusion had arisen, but the county overcame it to serve the public. They also interviewed a few grateful residents, one praising the convenience of getting a shot close to home, another ridiculing the notion that it was dangerous. Karen declined to comment on camera. The story portrayed her as alarmist and anti-public health. In response to the coverage, the county health department released a formal statement reaffirming its commitment to bringing vaccination services directly to communities. They praised Brightleaf Grove's board, minus Karen, for supporting the pop-up, noting the success and the number of immunizations administered. The statement concluded that they stand ready to partner again in the future. Within Brightleaf Grove, a wave of support for the clinic soared. People who missed the first day asked if the department could do a second pop-up. Linda tentatively agreed, scheduling another date in a month for booster shots. Ms. Jenkins indicated the board would fully cooperate this time. Karen's meddling wouldn't be tolerated. If she tried anything, Ms. Jenkins promised they'd call the county or the police for immediate override. Karen's reputation cratered further. Some neighbors who once supported her strict approach to landscaping or quiet hours now felt she'd exposed the community to ridicule. Rumors swirled that a recall petition was forming. Ms. Castillo confirmed she'd fielded inquiries from at least 40 residents wanting Karen out. Although recall processes can be messy, the momentum was building. The fiasco over vaccines might prove the final straw that dethroned her from the HOA presidency. Karen, cornered, attempted to salvage her image. She posted a lengthy letter on the HOA forum titled, "Why I Opposed the Vaccination Pop-Up." In it, she repeated claims about potential disease exposure, traffic concerns, and outsiders flooding the streets. She insisted she was protecting the neighborhood's best interests and apologized only for the miscommunication with the board. She blamed Ms. Jenkins for failing to present the full scope of residents' complaints. The letter garnered harsh responses from neighbors. People criticized her for ignoring the official data showing no large influx of outsiders, no major traffic jam, and no disease outbreak from a simple vaccine clinic. One resident posted, "I had to drive half an hour to urgent care after you canceled, just to get a flu shot. Thanks a lot, Karen." Another retorted, "Spreading misinformation about vaccinations is dangerous. Let professionals handle it." Meanwhile, the recall petition gained traction. A special membership meeting was scheduled to discuss President Karen Whitfield's removal, with the date set for 2 weeks away. Ms. Jenkins said the threshold of signatures to call that vote was already met. People were outraged that Karen overrode a board decision and antagonized the county health department. The fiasco overshadowed any beneficial work she'd done as president. She faced certain defeat if it came to a membership vote. Desperate, Karen tried to contact Dr. Howard privately, seeking a compromise. He told Linda he politely listened, but refused to concede any wrongdoing on the department's part. He made it clear that the pop-up was legitimate, that her attempt to cancel it was invalid. Realizing no olive branch from the county was forthcoming, Karen retreated from the public eye, awaiting the special meeting that would determine her fate. The evening arrived for the special membership meeting to consider Karen's recall. The community center was packed to capacity, a rare turnout. Everyone anticipated drama. The entire board, minus Karen, sat at the front. Karen took a seat in the front row, forced to watch the proceedings. Ms. Jenkins opened by summarizing the official reasons for the recall: violation of board protocol, issuing a fake emergency resolution, interfering with a properly sanctioned public health clinic, misrepresenting neighbor sentiment, and damaging the neighborhood's relationship with the county. Karen was given a chance to defend herself. She stood, reading from prepared notes, claiming she never intended to harm the community. She insisted the board gave her partial authority to act in emergencies, that she believed the clinic was a threat, and that communication broke down. She asked for leniency, saying she'd served faithfully for years. But her tone wavered, like she sensed the crowd's hostility. Various residents then spoke. Some recounted frustration at losing an easy vaccination opportunity or needing to reschedule shots. Others lambasted her for humiliating the neighborhood in the eyes of the county, risking future partnerships. A few tried to be sympathetic, recalling positive things she'd done in the past, but the majority felt her sabotage was inexcusable. Finally, Ms. Jenkins called for a membership vote: yes, to remove Karen from the presidency; no, to keep her. Paper ballots were collected in a box, and volunteer counters tallied them. An electric silence filled the air. Karen sat stiffly, color draining from her face. After about 20 minutes, Ms. Jenkins read the result. Out of 221 votes, 173 favored removal, 48 opposed. It was a landslide. Applause and cheers erupted. Karen closed her eyes, a tremor in her lips, then stormed out before the meeting officially adjourned. The new interim president, Ms. Jenkins, addressed the crowd, promising a more open, collaborative style and vowing never to undermine board decisions unilaterally. The membership gave her a standing ovation. The fiasco was over. Karen had lost her power, undone by her own anti-vaccination meltdown. Karen's dethroning marked the end of her official reign. The board also voted to bar her from holding any leadership role for 5 years, citing gross misconduct. Many neighbors, fed up with her controlling style, welcomed the news. Ms. Jenkins quickly scheduled a second vaccination pop-up for the next month, ensuring residents who missed the first day could still get immunized. Linda and the health department welcomed the gesture, praising Ms. Jenkins's leadership. In the following weeks, Karen retreated from public view. She remained a homeowner, but her influence vanished. Rumors swirled that she considered moving away, but no listing appeared. She was forced to watch from the sidelines as the second pop-up clinic took place, a huge success. Over 80 shots administered, neighbors smiling, the county officials congratulating Ms. Jenkins for her support. The local press did a follow-up story. Brightleaf Grove's second vaccine day proceeds smoothly, freed from HOA turmoil. Meanwhile, the new board refused to let Karen's sabotage hamper future collaborations. They invited the county health department to consider regular annual clinics. Linda and I beamed with pride, seeing how the fiasco ironically spurred more robust ties with public health. Ms. Jenkins said it was a silver lining. Karen's meltdown awakened the community to the value of direct health services. As for Karen's punishment, it was twofold: permanent removal from the presidency, plus a multi-year ban from HOA leadership. Public disgrace. The entire neighborhood recognized her attempt to cancel the clinic was baseless fearmongering. She no longer commanded respect or deference. Some neighbors, though outraged, pitied her. She'd built her identity around controlling the community. Now that was gone, replaced by scorn. Her final blow came when Ms. Jenkins posted meeting minutes publicly, documenting the entire sequence: Karen forging an emergency resolution, ignoring the Real board vote, and the county's direct override. The minutes concluded: this association condemns Ms. Whitfield's unilateral sabotage of a beneficial health service and reaffirms our commitment to the well-being of all residents. Indeed, Karen's name was forever tainted in Brightleaf Grove's records. Months later, the dust settled. Brightleaf Grove thrived under new leadership. Ms. Jenkins led fresh community events, from neighborhood block parties to volunteer drives. The fear of outsiders or sick people never materialized. Instead, neighbors felt reassured knowing they had easy access to shots and a direct line to county services if needed. The second pop-up clinic success sparked talk of an annual health fair. Linda proposed including screenings for blood pressure, cholesterol, and hearing tests. The board embraced it wholeheartedly. Dr. Howard applauded the transformation, remarking that it was rare to see an HOA bounce back so strongly from a confrontation with public health. He recognized me at a small ceremony, praising my perseverance in bridging the gap between my profession and my neighbors. Karen, meanwhile, remained in her house, rarely attending community gatherings. The new, more open and health-focused environment starkly contrasted her old approach. Occasionally, I glimpsed her in passing. She'd avert her gaze, perhaps still resentful or ashamed. But the community had moved on, forging a spirit of collaboration that overshadowed her earlier negativity. Reflecting on the saga, it's striking how something so beneficial, a simple vaccination pop-up, could trigger such resistance from a single overbearing HOA president. But in the end, the unstoppable authority of public health, combined with broad community support, triumphed. Karen discovered, too late, that no personal vendetta can stand against an officially sanctioned, well-intentioned service for the greater good. Thus ended the story of how HOA Karen canceled my vaccination clinic, only to be blindsided by the immediate response of the public health department and the community she once claimed to protect. In her downfall, the neighborhood found new unity, stepping forward into a healthier future, free from the tyranny of one misguided individual's power trip.